Hi everyone, I hope you guys are keeping well. In this video, I'm gonna talk about disc bulges, herniated disc, and so many other terms that you've been seeing in your MRI report. I've prepared for you a series of videos about explaining your MRI report that can help you to understand more about your MRI and what does that mean, and you should be worried about these terms or not. Let's get started. Alright guys, for many of you guys who experience episodes of back pain, lower back pain specifically, you might go get an MRI, end up having a basically person who read that report for you or send that report to you, and you might have faced with degenerative disc diseases. What does that mean? In this video, I'm going to explain for you what does that degenerative disc disease means. Should we call it as a disease or maybe we shouldn't? At the same time, I'm going to explain for you and share with you the symptoms of this condition, what are the treatment options. At the same time, I'm going to share with you what you can do at home to overcome this problem. You're going to follow this exercise on a daily basis, and I'm going to guide you how to progress it by the end of this video. Make sure to watch this video until the end, and I'm going to help you to understand what is degenerative disc disease means and what you should do about it. Your spine is made up of 24 bones called vertebrae that are stacked on top of one another. These bones connected to create a canal that protects the spinal cord. 5 vertebrae make up the lower back. These areas called your lumbar spine. In between your vertebrae are strong and flexible intervertebral discs. These discs are flat and round and about a ½ inch thick. Intervertebral discs act as a shock absorber when you walk or run. They are made up of 2 components: annulus fibrosus, this is a tough, flexible outer ring of the disc, and the nucleus pulposus, this is the soft, jelly-like center of the disc. As we age, our spine starts to degenerate, and this degeneration is a normal aging process of our body. It happens in our skin and our hair. As you can see, the disc degeneration can cause some sort of pain in your lumbar spine, and the symptoms of this condition can be pain at the site of the injury, pain and numbness or tingling in the legs, strong pain that tends to come and go, pain that worsens when bending, twisting, and or sitting, pain would relieve when you lie down. These are the symptoms of degenerative disc changes in your lower back, and in many cases, we have a very solid treatment plan for you. What study and research suggests, the treatment plan for degenerative changes in your spine can be divided to physical therapy and strengthening exercises. In some cases, in acute pain, rest and restriction of physical activity. You may use injection to help reduce the pain and swelling, and in some cases, they may give you medication and analgesic to reduce pain and swelling. Now I'm going to share with you guys a series of exercises that you're going to follow specifically for degenerative changes in your spinal cord. And as you can see, one of the most and common way to improve this condition is conservative treatment and physiotherapy. And in this video, I'm going to share with you exercises that can help you to strengthen your spine and help you to improve your pain, improve your mobility, and help you to recover from this condition. You're going to try this exercise on a daily basis for 4 to 6 weeks, and I'm going to share with you at the end of this video how to progress them and how you can actually overcome this condition. All right guys, the first exercise that I'm going to share with you guys is going to be back extension. I'm going to share with you different variety that you can do it in a seated position, a standing, and on a prone position. You're going to lie down on a belly, and basically what we're going to do, we're going to try to hold your hands next to your armpit, and we're going to slightly bring you back off the ground. Breathe in and out, and control down. Back up again, and control down. You can repeat this exercise 3 to 4 times through the day for 3 to 8 repetitions. Back up again, and control down. If you can't do it in a prone position, I'm going to share with you 2 different varieties that you can do it in a seated position or standing. Now, back extension can help you to improve your pain. The first exercise has to improve your pain, and you can repeat this exercise as many times as you want through the day, and slowly you can progress them to the other exercises. The second exercise that I'm going to share with you guys is going to be bear dog, which is a simple but very effective exercise for you. The second exercise that I'm going to share with you guys is going to be bear dog. That is a very simple but effective core exercise routine for you to improve your core strength. I'm going to share with you how to do it, and you can give it a try. You're going to be on a quadruped position. You're going to start to move one legs and one arms alternate and hold for a few seconds, back again. And go back there again and control back. If you can't move both at the same time, so you can start with the leg, hold it there, 3, 2, 1, back again, 3, 2, 1, and gradually add on and progress it to alternate. You can try them for both sides. Control, forward, and control. We're going to try bear dogs for 3 sets of 5 to 8 repetitions in each side. This particular exercise can help you to strengthen your core, and if you're suffering from degenerative changes in your spine, you are going to need to improve your core strength and get fit in overall. The next exercise that I'm going to share with you guys is going to be figure 4 stretch, which is a simple but very effective exercise to improve your hip mobility, and actually at the same time can help you to reduce your hip pain or your low back pain. You're going to lie down on your back and you're going to cross one leg over the other, and in some cases even holding that can be enough, but if you want to progress it, you can bring the opposite leg up towards the chest and hold it there 5 to 8 seconds. If you feel more comfortable, you can keep it up to 20 seconds in each side. You're going to try the side that is sore and hold it in that position. Try to relax your shoulder and go towards the range that you can feel comfortable. I've shared with you in a seated position how you can try it, that if you didn't have that mobility to sit down and do this, you can do it on a chair and you can get the same effect. The figure 4 stretch can help you to improve your pain, help you to improve your hip mobility, and at the same time in acute phase, you're going to need to do this exercise on a daily basis. The next move that I'm going to share with you guys is going to be nerve glide, which is if you're suffering from degenerative changes in your lumbar spine. In some cases, you might have symptoms of sciatica down to the leg, tingling sensation or pain, and in this exercise can help you to improve that condition and symptoms. You're going to lie on your back, and we are going to try this nerve glide. Very simply, you're going to bend that knee and hold the knee that is actually feels that tingling sensation, and you're going to bring the toes up and control down. These two movements should happen at the same time, so you bring the neck up and down at the same time. We're going to try this for 3 sets of 8 repetitions. Stone control. You don't need to pull this too much. You're holding it very gently, and you're doing these 2 movements at the same time. The toe go to the dorsiflexion and the neck come back. Then you flex the neck and bring the feet back to the starting position. The nerve glide is a very simple but effective exercise for you to improve that tingling sensation and pain from sciatica in your lower back and the hip. And I would recommend you to try this as many times as you can through the day. If you don't have that mobility to lie down on your back, you can do the same thing in a seated position as I share with you here. Give it a try and let me know if you have any question. The next move that I'm going to share with you guys is going to be forward flexion, and it's one of those exercises that you want to get as quick as possible into your routine and get comfortable with it. It has different progression that I'll leave you a link below that you can actually check that video in details, that how you can progress it from easy to more difficult. But I'm going to share with you how to do it, and you can give it a try. This exercise can help you to improve the mobility of your lower back, and if you're suffering from degenerative changes, that mobility can be a little bit compensated due to the spasm of your lower back, and it's purely due to your nervous system trying to be overprotective. You want to break that chain and you want to improve your mobility as quick as possible. You need a chair, and what we're trying to do, rather than coming from a standing position and bending forward, you're going to basically simplify that to a seated position, and you are going to focus on your breathing and gentle flexion movement down to the leg and come back up. You can start with something as simple as that. Come back up. Breathe in and breathe out. How low you can go, it all depends on how much your body give you that mobility and chance to go. Breathe in and breathe out. Try to don't force it. Go to the range that you feel comfortable. Practice this forward flexion 3 to 4 times through the day for as less as 3 to 4 repetitions. And this particular exercise can help you to improve your mobility. At the same time, it can actually improve your pain and create more mobility and create more basically stability in your lumbar spine. Give it a try and let me know if you have any question. Thank you guys for watching this video. I hope you have understanding about degenerative disc changes in your spine, and by now you understand that it's not as scary as you know, and you read it in your MRI report. If you have any question regarding disc bulges, your MRI report, or anything regarding your injury, you can always leave me a comment and I would always answer all of my questions in my channel. Make sure to subscribe my channel for my weekly update, and don't forget to press that like button. If you need further assistance, I'm always available. You can always book an online consultation with me with the link below, and we can have a customized plan for you to start your recovery, and we can have a face-to-face chat over Zoom call and create a plan for you for your full recovery. If you have any other question, I would be more than happy to help. Leave me a comment and I will get back to you. Until next week, all the best.